Good afternoon, everyone. I'm Anya Prusa, Senior Associate at the Wilson Center's Brazil Institute and Coordinator for its project Accessing Justice, Femicide and the Rule of Law in Latin America. It's my pleasure to welcome you all to this event, Combating Gender-Based Violence in Latin America, Lessons from COVID-19 and the Work Ahead. We are very glad to be partnering today with the World Bank, given their significant body of work on gender equality and gender-based violence, including in Latin America. As many of you know, gender-based violence is not new. These are crimes with deep cultural roots. To give just one statistic, 91% of men and 86% of women show some kind of bias against gender equality in El Salvador, according to the United Nations Development Program. What is new is the growing sense of urgency and attention among policymakers, the media, the public and civil society, including organizations like the World Bank and the Wilson Center. COVID-19 has exacerbated the scale of our challenge, but it has also driven home that we need to tackle this challenge. Across Latin America in recent months, we have seen reported violence rise. Stay-at-home regulations, so important for preventing the spread of the coronavirus, carry their own dangers for women. Worldwide, 60% of murders of women are committed by an intimate partner or family member. At the same time, providing support services for women who suffer violence has become more complicated. Yet there is a growing body of work, of research and policy interventions that offer a path forward and allow us to look at what works and what doesn't, from training members of the judicial system to improving data collection and transparency. And this is what we hope our conversation today will do. To lead this conversation, it is my pleasure to introduce Dr. Mary Ellsberg, the Executive Director and Founding Director of the Global Women's Institute at the George Washington University. Dr. Ellsberg has more than 30 years of experience in international research and programs on gender and development. Dr. Ellsberg, I'm going to turn it over to you. I think you'll have to unmute.
Okay. Are we good now?
Yeah, you're good.
Thank you very much. Yeah. It's a real pleasure and an honor for me to be here today with you and with our distinguished panelists. And what I'd like to do before handing over to the panelists is to give a bit of a snapshot of the situation that we were already in before COVID-19 hit, because I think it's important to recognize that it not all was working the way it should before we started. Now things are even more challenging. So in some ways, we've come a very long way in the last 25 years since the Beijing Conference for Women, and where violence against women was treated as a critical human rights and development concern. And evidence of this is the fact that violence against women is now included as a standalone target in the Sustainable Development Goals. So in terms of putting this onto the international agenda, we've already achieved a lot. But there's still so many challenges in terms of responding to and preventing violence against women. And particularly in Latin America, we see unacceptably high levels of intimate partner violence, sexual violence, and femicide. In the Americas, at least 1 in 3 women experience physical or sexual violence on the part of an intimate partner. A study that I was involved in recently in Nicaragua found decreases in physical partner violence, but no decreases over the last 20 years in sexual partner violence. And in that study, 40% of women had experienced sexual violence by a non-partner. That is either at home, at school, in public spaces, on public transportation, and also now more increasingly through cyber violence. We also know that Latin America and the Caribbean has the highest levels of femicide and violent deaths of women in the world, with El Salvador, Honduras, Guatemala, Colombia, Mexico, and Brazil in the lead. Some of them have 3 and 4 times the global averages of femicides. And in contrast to other countries and other regions where intimate partner violence usually makes up about at least half, or family violence, even 60% of all violent deaths, In Central America, intimate partner violence makes up about 10 or 12% of the total number of femicides. And that makes us believe that organized crime and gangs are actually accounting for a large part of the growth in femicide there. Now, in the area of access to justice, according to the World Bank's Women, Business, and the Law reports, between 1976 and 2018, over 75% of countries had laws against domestic violence. And I believe in Latin America, every country or all but one have laws. However, this is really only the first step. We know that laws are not being resourced properly and they're not being enforced. Impunity is still the norm, and for many women, or in some places most women on the ground, little has changed in terms of their ability to seek access to justice. Most survivors still do not report intimate partner violence to the police because of shame, fear of reprisals, or fear of stigma. And in the case of sexual violence, reporting is even more rare. Moreover, most cases are not fully investigated or prosecuted and don't make it to the courts. The few that do make it to the courts, very few are actually sentenced or convicted. In the case of services, we have seen in Latin America a lot of improvements. For example, several one-stop shop types of models like Ciudad Mujer in El Salvador and Honduras, hotlines, women and children's police centers, and shelters have been set up in many places to provide case management and psychosocial counseling. And another great achievement recently has been the WHO guidelines, clinical guidelines for addressing violence against women in the health sector, together with the essential service package that the UN has put out. So we have made progress, but those services are still woefully underfunded, even before COVID-19. The quality is very uneven. There's not enough coordination between services. And finally, most of them are located in urban centers. So rural women still have very, very little access to services. I want to say before ending a few words about prevention. There's been much greater recognition in Latin America over the recent years of the importance of prevention of violence against women and girls, because formerly much of our attention was really on access to justice, changing laws, and providing services. And now we're beginning to understand that prevention is really key to sustainable reductions in violence. And we have some very encouraging examples and evidence of what works. Many of you have heard of the SASA program that was developed, a community mobilization program that was developed in Uganda that reduced violence, intimate partner violence, by 50% in 2 years. That has been translated into Spanish and is being conducted right now in Honduras and in Haiti as well. And in Nicaragua, I recently completed a 20-year follow-up study of trends on violence against women in the country over a 20-year period. And we found a 70% reduction in physical intimate partner violence over that period from 95 to 2015. And we think that that was largely due to great multi-sectoral efforts, including civil society and the government, and efforts to transform social norms. So the last point I'd like to make, though, is none of this happens in isolation. Reductions require a lot of coordination between different sectors, and specifically, I'd like to call out the contributions of the women's movement. And research around the world has shown that the major predictor for any country to have good policies or laws on violence against women is to have an autonomous women's movement. So that is something that we need to celebrate, particularly in Latin America, where the women's movement has really been very strong and vibrant for decades. However, a worrying trend is that funding to these movements, as funding goes more into national governments and programs, that women's movements are sometimes being sidelined and not receiving funding. Also, research has shown that investment in prevention of violence against women is tiny. Over the last 5 years, it is less than 0.002% of official development assistance. So we already needed much more investment than we had before. And a final worrying trend is that women human rights defenders have been concerned that the COVID-19 crisis is creating a space for increased authoritarianism among governments and closing civil society spaces, and they're seeing the effects in terms of harassment and violence towards the human rights defenders. So this is a quick snapshot of where we were before COVID-19 hit, and now I'm looking forward to hearing from my colleagues about the impact that the pandemic has had in their specific countries and what innovative solutions are being used to address it. So next we'll be hearing
Mary, your micro was mute, and we didn't listen the last part.
Yeah. You didn't? Oh.
Yeah. Okay.
I don't know how that happened. I'm sorry. Well, I don't. Was the last part that I was handing over to Paula?
Yes.
So I hand over to Paula, who will be talking about a brief that they recently did in Brazil on violence against women under COVID-19. And excuse me.
Thank you. Thank you, Dr. Ellsberg. Thank you for joining us, for accepting the invitation. I'm here, we'll be presenting, and I'll talk a little bit about this, but also we co-organized this event with the Wilson Center, and thank you to Anya and to the colleagues on the other end as well. For us, it's an honor to be able to bring such high-level speakers and presenters together, and you and all the experience that you bring to the table with on these issues as we're trying to figure out how to address the increasing challenges, especially with COVID. And so that's really the idea here. And I'm very happy that we'll be hopefully learning a lot of new lessons today, and already are. So as you mentioned, I'll be presenting, and I'll share my I'll be presenting a little bit of a snapshot of work that we've been doing in Brazil, which is looking at the increase in cases, the surge in violence, some of the risk factors behind it, but also looking at and compiling some of the measures that have been adopted by the federal government, subnational governments, also looking around the world to see and drawing some lessons in terms of what can be done, what has been done, what countries are doing, what countries have been doing, but also looking to the future, which I think is part of what we're trying to look at today, and see, what can we start learning from what is being implemented now, so we can improve on this, continue doing what is working, and make sure that we can more quickly mitigate some of these impacts and address violence against women. So that'll be a little bit of what I'll be looking at. I'd also like to thank my colleagues, Gabriela Bastos and Flavia Carbonari. They're both online. We worked on this together. I'll be presenting on behalf of the three of us, but they equally participated, and we hope to have some of this work out soon. This is, for now, a snapshot. So first of all, this is kind of background information. I know that we've discussed this in the introduction, but this is part of what I think is critical to understand, is that we've already acknowledged, both from emerging evidence from COVID-19, but also from past epidemics, that significant risks of violence against women, of gender-based violence, increase even more in these contexts. And that's what we're seeing in Brazil and around the world. Some of the risk factors, and there are more, but these are some of the key ones that I think have been identified by governments around the world, by response service systems, is one, women are already at greater vulnerability, both economically and in other ways. Care burden for women is higher than for men. That is increases the vulnerability economically, also the capacity to have financial independence. Women earn less, save less, hold more vulnerable jobs in general. Heightened unpaid care burden and risk of sexual exploitation increase in these contexts where women are mostly staying home along with men, but they're the ones responsible for this type of work. They're limited in their capacity to work. They also more generally, and we know this in percentages, take on face-to-face jobs that are at greater risk of becoming unemployed. And so those percentages and those proportions we've seen around the world. Greater exposure to violence in general, especially with quarantine measures, staying at home with abusers in a situation where both are dealing with problematic coping behaviors, mounting social and economic stress due to all of the issues around us, the health risks, the economic vulnerability, and just that increases tension at home. And compounding that, you have limited access to services and resources. So both limited mobility to escape with stay-at-home measures, confinement, social isolation, but also in terms of services available, we've seen a contraction in many countries, especially in the beginning of health security and justice sector services. So less access to services and help for women. In Brazil, what we've seen is, and this is data from the Public Security Forum, the Public Brazilian Security Forum, compiling data from subnational governments from different states around the country where data was available on different types of violence against women, but also reporting of violence and calls to helplines. What we saw was that in terms of femicides, and that's the most extreme form of violence against women, there was a 22% increase, a little bit more than that, between March and April, if you compare March, April 2019 and March, April 2020. So that was a huge increase. And we also know, even given these figures, that in some cases there's some under-reporting on this, because the way this is classified in Brazil is you have a law on femicide. And so femicide is a specific crime against women. So it's the killing of women or homicides of women because of the fact that they're women. And this has to be classified properly when reporting. And so in many cases, we also know that the numbers don't necessarily match the reality in underreporting due to misclassification or later classification of femicide. What we saw was also an increase in complaints at the National Violence Against Women Helpline. This is the 180, VG 180, the Call 180 helpline, so a 27% increase. So where women had the possibility of making these calls, these complaints and the reporting did go up. However, when we look at, for example, reporting in police stations and in-person reporting for the most part, especially in the beginning where most of these services were not offered online or were not offered in remote possibilities, we saw reporting go down. So reporting of rape cases went down by about 28%. And this is always considering a comparison between data for March and April 2019 and March and April 2020. And reports of physical aggression cases as well went down by about 25%. And so this showed the challenges for reporting these situations. It's been acknowledged that this does not mean that the violence has gone down, but rather that there have been large barriers to reporting, right? And so what we've seen with this is that measures have been adopted in many countries and in Brazil to respond to the new and increased challenges in different areas. So in many places, we saw revisions to justice system, increased resources, media campaigns, innovative support. Here we're pulling information that's been compiled by the World Bank as a whole as well, looking at measures implemented around the world. So not just Brazil, not just Latin America, but in different countries, and just bringing a few of the interesting examples that we've been seeing. So for example, specific training for police in Bolivia, and we've seen that in other countries, virtual court hearings in Mexico, and also in many countries, then we've started seeing these georeferenced help, these through apps or through other forms, online reporting issuance of protection orders. That's also been done in France and many other countries. Brazil has started doing this. Increased resources to provide services, both in shelters, accommodations, so free hotel rooms being provided in Belgium, counseling provided 24 hours, increased staffing for violence against women, hotlines and chat rooms. So basically increased budget for some of these services to respond better. Media campaigns have been critical as well, and that's the awareness raising, that's kind of information dissemination on access to services and help, but also trying to understand and communicate around the access to services and what women can do. So we've seen very innovative types of campaigns as well around communication, music video campaigns. There's one example from Kenya, different services adverts. In Colombia, life skills kits were done in different places around the country, and many hashtags. We saw that. This one is from Chile, No Está Sola. We had a few in Brazil that we saw as well, and many countries around the world, hashtags and social media being used to disseminate information, to connect people and provide these networks of support through social media. Innovative support around that were some other initiatives, both using technology with WhatsApp reporting, for example, and providing help. Argentina, Colombia, Uruguay, Mask 19 and code words were seen and have been used also in different countries. We have examples here from Spain and France, a flag initiative in Guatemala where flags of different colors were used to signal different types of situations, so violence, calls for help, etc. And that was used also as a way to, a creative or an innovative way to report violence. What we've seen in Brazil is that, as I mentioned, several of these measures were also adopted here. This is, again, just a snapshot of some of the examples from around the country, and we've seen examples in different regions of the country, in different cities, both at the subnational level, at the state level, at the municipal level. So both technology-based resources, creating apps, adopting of online and offline support services, communications campaigns. The federal government has launched both a national contingency plan, awareness raising, campaigns and communications, guidance, response measures. The federal government has also adopted legislation to increase protection, providing that violence against women's services are deemed essential and should be prioritized. That was more recent. In other places, we saw social workers providing psychological support to women at risk of violence, the implementation of online filing of violence against women cases. This was in Sao Paulo, but also in other places around the world, and expanded protection and services, implementing online reporting and assistance for cases. So some of these, the key areas that we see a lot of these response measures and policy measures adopted were around strengthening response and support systems, ensuring and providing financial support, adjusting security and justice services, and improving data awareness. So a lot of these around these four kind of main areas. In terms of some preliminary recommendations, I won't go through all of these. These are examples, and this is what we're working on. But looking at some of the strategic areas, and this is also looking at what we've seen so far and what we've identified from the measures that have been adopted, also from civil society organizations and different technology-based applications, etc. So again, around violence against women-related first response systems, availability of resources, technology-based solutions, awareness efforts and access to information, the integration of violence against women response, strengthening and coordination amongst different stakeholders and different government levels working on these issues, and the availability and collection of data. So some of these are the recommendations that have come forth from what we've seen that has been done and is being doing. And I know that some of the other speakers will talk more in depth about some of the initiatives that have been undertaken in their countries and the region. So a lot of these, again, around expanding, strengthening, adjusting services, technology-based solutions, awareness raising and bystander reporting has been a one that we've seen critical in Brazil, but also in other countries, with engaging the community for surveillance as well, different online, offline communication strategies, coordination, and data collection and sharing. In terms of longer term, and this is the idea also going into the prevention aspect, as you mentioned, Dr. Ellsberg, that's something that we've seen in the area of addressing gender-based violence as a relatively more recent area in comparison with response. And part of the recommendations and what we've seen as well emerging from the crisis that we should envision to take forward and maintain and continue as also a matter of preventing different or increased risks and these situations in the future. So again, around similar strategic areas, but thinking more medium and longer term is equipping health systems and first responders adequately for pandemics, ensuring that referral protocols, standard operating procedures are regularly assessed and updated, that the financial and human resources are made available and are adequate for violence against women services, developing and implementing technology-based solutions to ensure access to information, service provision, and data collection. We've seen that as a critical area that's surged during this crisis. Continued awareness efforts, integrating violence against women into different sectoral response and preparedness measures, expansion of social safety nets with integrated violence against women elements, ensuring that women's leadership and participation in decision-making is present, and again, ensuring the regular collection and integration, systematization of violence against women data, as well as disaggregated data on the impact of pandemics. So again, that was just a snapshot. That was the idea. We hope we can discuss a little bit more, see some of the other examples from other countries. Thank you in advance.
Thank you very much, Paula. It's really exciting to see in a very relatively short period of time, a very short period of time, 3 or 4 months, how much innovative thinking and initiatives have taken place around something that's really quite unprecedented. Next, we'll be hearing from Ana Elena Badilla, who is the UN resident representative for UN Women in El Salvador. Ana Elena is the current country representative for UN Women and previously served as the regional advisor on gender and youth for the United Nations Population Fund, UNFPA. She's a lawyer from the University of Costa Rica with a master's degree from the Inter-American University in Panama and specialized studies on youth from the National Autonomous University of Mexico. Ms. Badilla has over 25 years of experience in regional organizations and projects related to human rights, particularly women, indigenous people, Afro-descendants, and young people in Latin America and the Caribbean. Thank you very much, Ana Elena.
Thank you, Mary. Thank you very much. First of all, I would like to, sorry, I'm trying to put the presentation. Well, good afternoon to all. I want to express my gratitude and also congratulate to the Center and the World Bank for organizing this series of webinars. And I want to give a greeting to Mary Ellsberg, our moderator, and my other colleagues in the panel, and all participants. Well, to start, I would like to say that at the same time as we face the devastating impact of the COVID-19 pandemic in Latin America and the Caribbean, as in all regions of the world, it is urgent to face another pandemic that cannot be left in the shadows, which is violence against women. This human rights violation affects an average of 1 women after their lives, and in 2019 alone, resulted in at least 3,800 victims of suicide in Latin America and the Caribbean. Although these figures seem very high, it is estimated that the real magnitude of the problem is underestimated, and that the emergency is making it even worse.
Sorry, Ana Elena, we're really having a problem with feedback and with your screen. So maybe we could stop for 1 second. One issue is I think that the screen needs to be made full screen. And does anybody else have an idea about what to do with the audio? I think this needs to become a slideshow. That will help. We're really having trouble hearing you.
Oh, I'm so sorry. It is
Microphone?
better now?
Nope,
No?
not for me. Anybody else?
No, maybe this is on your person. Maybe Annalena, you could call in over the phone for audio. That might be one option.
Okay. Maybe we can continue with another participant. I am trying to
Can we do that?
Yes,
Okay, sorry,
Yeah.
Annalena.
we will figure it out.
Okay, so we'll move on with Veronica Martinez, who is the Director of Research for the Safety, Security, and Development Initiative at the Fundación para el Estudio de la Seguridad y Gobernanza in Mexico. She is the Director of Research there, as well as a member of the Board of Directors and responsible for the Latin American program at the International Organization for Victim Assistance. This is an organization with special consultative status with ECOSOC at the UN. She's worked since 1992 on issues associated with criminal sciences, such as criminal law, victim assistance, crime prevention, policing, criminal justice, and gender in several countries in Latin America, especially Mexico, both in academic research and in the formulation, implementation, and monitoring of projects, policies, and programs. Shall we take a quick sound check with you, Veronica?
Yes, sure. Can you hear me?
I think that's good.
Yes.
Is that good for everybody else? Great. Yes.
But
Please
also
go
I
ahead,
have some
Veronica.
background. Yeah. Okay. First of all, I very much appreciated this invitation and opportunity to participate in this important webinar and with exceptional professionals. Thank you very much to the World Bank, to the Wilson Center for the invitation. And from the FENSEGO, it is important to mention that this presentation draws much from our own experience on issues of violence and crime prevention. Is very important for us in Mexico specifically. This will allow us to contribute to the conversation with elements that, based on concrete examples, can better inform about the challenges and opportunities that government and, very important too, the international cooperation agencies faced on gender issues in this current crisis. Well, as I previously said, here's what I'm going to present. I have divided in 4 questions, trying to answer all of them. And we already have information about the first 2 questions, and the last 2 are the ones that I consider the most relevant lessons learned and what could be done. Some information has already provided, and this is very important because after 25 years from the Beijing declarations, there are many achievements, as Professor Mary said, but there are many, many challenges yet, specifically some of them on how to reduce and prevent violence against women, and how we can persuade governments to invest more on women than they are investing right now. So the first point that I would like to raise is the importance of the context in which this crisis is evolving. Although the COVID-19 pandemic is mainly and health issues in Mexico and other countries of the region have been facing already another pandemic, and it is the pandemic of violence. As most of you know, Latin America and the Caribbean is considered the most insecure and lethal region at the globe, and where suitable actions have not yet been achieved to reduce violence in a sustainable way. This is particularly relevant in the case of gender-based violence. The pandemic has turned out to come on the top of pre-existing problems, which has amplified those in multiple dimensions. It is the adding up of a crisis to multiple pre-existing crises, including the gender-based violence. It is possible to say that the characteristic of this pandemic is lack of reliable information, absence of plausible scenarios even over the short term, persistent contradictions and dichotomies of public policies and strategies. If we are going to invest in domestic violence, for example, we have to cut the budget of other strategies, lack of effective and coordinated collaboration amongst government agencies, local governments, organizations on common issues and in an interdisciplinary way. However, there is sufficient preliminary data to point out the considerable increases in different forms of violence against women, especially domestic violence, intimate parent violence, and lethal violence. per se, accurately measuring prevalence and incidence of gender-based violence, violence against women, and intimate parent violence is difficult undertaking. Generating high-quality data requires many components that not all countries in the region have. Mexico has many problems measuring despite so many efforts like the specific survey, a national specific survey. It also depends a lot on what the selected indicator is measuring. It is very different, those data, from family disputes resolution, psychology service, legal service, support victims, to support for victims, to measure domestic violence, intimate parent violence, or others other problems like lethal violence. These failures have affected the legitimacy of the Mexican government due to its often inadequate and not always timely response to the crisis that immediately affect women, families, and communities in their daily life. The latest report of the OAS indicate that all countries of Latin American countries have implemented some type of actions which are almost always the same existing institutional channels as hotlines, police services, prosecutors, or virtual access of justice for women. Not all women have such information that is very important, and not even resources to access the services. Innovative codes were implemented in Chile, Mascarilla 19, for example, or Ecuador, Canasta Roja, although they have not been evaluated, and we don't know if women are accepting them as a way to reach the services. On the other hand, countries like Mexico or Guatemala have already reduced the budgets of programs that mitigate, prevent, and address different forms of violence against women, including many focus on reducing inequality gaps. International cooperation agencies and the United Nations systems, such as the UN Women, UNODC, the World Health Organization, have also developed multiple tools. That means that we have many resources and we have just little examples. From Mexico, there are 3 programs that have not been designed to respond to the effects of the epidemic by COVID, but whose potential is very high according to other evaluations. Just imagine how much we can do if we are taking what is already implemented and we are focusing on women's problems and gender-based violence. And actually, these 3 examples are relatively simple. The first is the COVID case trial. It is a platform designed by the Mexican city government to target areas of infection, very high areas of infection. It is like a georeferential approach to the COVID. And although the data portal only advertises services for women, there is a local government program that performs massive tests to detect COVID, visiting house by house. It could be great if very specific questions about domestic violence or gender-based violence were added to the battery of health data. There is enough knowledge to point out that where there is greater family stress, different forms of violence increase. On the other hand, the domestic violence insurance program is an economic support for women who experience domestic violence and is provided as long as the women and their children attend therapy and other support services. It has very well evaluated and could be extended to households detected during the health home visitations by COVID. Finally, there is Tandas por el Bienestar. It is a microcredit program that is being implemented in a more inclusive way than at the beginning. At the beginning was without any gender perspective. And that's it. We do not have to reinvent the wheel, but we have many lessons learned from previous analysis of the responses to the violence in Latin America, not only the gender-based violence, but all violence in the regions. And some lessons from the governance sectors is are the following. First, avoid parallel and coordinated agendas. We have identified, not only Mexico, but also in other countries, we are working at the regional level, that international cooperation, local responses, and for example, government responses are highly centralized. And we can understand sometimes when they are tackling urban violence, and because women, 70% of women are in urban centers. But what happened with the results from these cooperations, interventions? Unfortunately, uncoordinated agendas can be identified in the region, not only in Mexico. For example, a Spotlight initiative is just tackling some topics, and the local government is just in another way. Focus primarily on urgent responses, neglecting sustainable solutions. It is always like responding to the crisis instead of for looking for more plausible solutions, such as reduction of violence, tackling specific kind of violence, or putting evidence on the place. The other one is analyze in deep unintended consequences that aggravate the situation of women. That is, we must implement a do not harm approach. And I'm going to take an example of this, and an example that we evaluated in 4 countries. Pay special attention to ethics and fighting impunity and corruption. As Professor Mary said, it is important not a case by case. It is more important the whole message that institutions are sending to women. If impunity is part of the solutions that they are doing, it is not a solution, it's another problem. But if impunity is the characteristic of the services, what is going to happen with the other responses that women can approach? And political will and technical leadership are essential. Make a strong statement from the international level. And why the political will? Because I have presented, for example, Guatemala and Mexico have reduced funding for women programs in the middle of the pandemic and even before. Right now, 75% of the general resources for the institutions are cut, and that means more of them are women focused. Okay, 13 slide. Why the unintended consequences that aggravate the situation of women is very important, because one of the solutions at the international level, and specifically the SDGs, is pushing the economic empowerment as the solution for the violence against women. And of course, it is one key component for the reduction of violence. Autonomy and independence, economic autonomy and independence for women is very important, because it increases, according to international evidence, it increases the stress in the house and, of course, gender-based violence. But according to our experience funded by the International Development Research Center, the Canadian IDRC, we evaluated at the qualitative level what was happening with those programs in 5 countries, specifically Mexico, Salvador, Guatemala, Colombia, and Peru. And we found 5 scenarios of economic empowerment. 3 of them are very positive, but 2 of them are increasing the risks for women to suffer violence in the short terms, probably in the long terms, and we don't have enough data to say at the long terms the violence is going to stop. But at the short term, 2 scenarios are increasing the violence against women, and we must be aware of it. It is not just a one-size-fits-all solutions. We have to look at those external conditions or those external premises that are necessary to work economic empowerment of women. Some of them are even reducing the independence of women at homes. For example, they are going to pay previous debts with the money that they are generating, or they are exploited by their partners. So we must be very careful about the solutions that we are implementing and what could be done. And probably that is why I selected the 3 programs in Mexico, because according to me, if you look at the evidence, the evidence in Mexico and other Latin American countries is working as silos, not how it could help in the short and medium terms. No. You look at the evidence silos, not how it could help in the short and medium terms, much more with the economic crisis and even crisis that the countries have. I used 2 examples in Mexico. It is, if you look at the examples, it is the Elmira project. As Professor Mary Ellsberg said, and I have just 1 minute, there are many examples at the international level. We have those from India, that is economic empowerment and how this can improve the situations of women at home, accessing to resources, but also diminishing domestic violence, preventing unplanned pregnancies, and increasing the access to a paid job by women, the same in Uganda, the same in some countries in Latin America. But the Elmira project is very important. We haven't looked at the evidence at the health sector. The Elmira project is internationally and has measured in Chile, for example, it can reduce children abuse, domestic violence, drug use, and planned pregnancies, and facilitate the incorporation of women in paid jobs. And the solution is just joint and coordinating 3 existing programs that are currently in Mexico City, that is tracking what is happening with the COVID and adding just some questions about gender-based violence. Second one, provided economic support with the insurance against domestic violence. And the third one, that is Tandas por el Bienestar, is providing some support for habilidades para la vida, life skills, and other abilities for women. This is a criticism not only for governments, but also for international cooperation. And again, the example is Spotlight Initiative. It is a very good initiative, but it has not focused on piloting or evaluating programs. Although it has few resources, it repeats the same paths of other initiatives that have failed. We must use evidence, specifically that which has been generated from the local level. And here I have just this example that is inspired, because evidence is working in silos and inspires its focus in children's. Probably we must communicate what is happening at that level. And finally, this is very important because according to international statements, this is a critical moment for women. There are some consequences that will be very difficult to reverse. Thank you very much.
Thank you very much, Veronica. That was very interesting and also very sobering. Is Ana Elena, are you now ready to go? Just to switch over?
Yes, I think, can you hear me better? Yes. Okay, but I will not use my presentation to be easier, this presentation. Okay, I was saying that at the same time as we face the devastating impacts of the COVID-19 pandemic in Latin America and the Caribbean, as in all regions of the world, it is urgent to face another pandemic that cannot be left in the shadows, which is violence against women and girls. This human rights violation affects an average of 1 in 3 women throughout their lives, and in 2019 alone, resulted in at least 3,800 victims of femicide in Latin America and the Caribbean. Although this figure seems very high, it is estimated that the real magnitude of the problem is underestimated, and that the health emergency is making it even worse. Measures to prevent and mitigate the spread of COVID-19, such as quarantine, social isolation or distancing, and mobility restrictions, have exacerbated the violence against women and girls in households. For the perpetrators, lose a job, financial instability, and stress are all facts that can generate a feeling of loss of power, and this can increase the frequency and severity of violence. In El Salvador, women represent 53% of the population, and as you may know, it was in the last years one of the countries with more femicide rates in the region and in the world. And in 2017, the denounce of violence against women was only 6%. However, in the last 3 years, the rate of violent deaths of women has shown a downward trend, going from a rate of 13 per 100,000 in 2017 to 11 in 2018 and 6 per 100,000 in 2019. The causes of this decrease have not yet been investigated. At UN Women, we believe that the increased presence of the army and the police forces in the communities has had an impact. But we will know that the military presence in communities also carries other risks of violation of human rights. The creation of the specialized courts in violence against women and discrimination, likewise, greater knowledge that women have to support institutions has contributed to increase denounces, and this has also impacted on the reduction of femicides. According to the Attorney General's office, there were 3,012 violent deaths of women between January 2012 and June 2018. And this office initiated investigations only in 2,700 cases, corresponding to 91% of the registered deaths. Of this total number of cases under investigation, only 20% had completed the judicial process. 14% concluded with a conviction and 6% with an acquittal. In this period, one sentence of femicide have also taken public relevance, applying the maximum penalty of 50 years and financial compensation of $50,000 in concept of civil responsibility to the family affected. This sentence makes it clear that reparation measures for the surviving families of the victims remains a pending matter in the country. During the quarantine, 1,324 complaints of violence against women were reported by the Attorney General Office, National Institute of Women, ISDEMU, and the NGO Ormusa. From March 17 to June 9, according to Ormusa, 28 femicides and violent deaths of women were reported. According to the Human Rights Observatory of the UCA, the Jewish University in El Salvador, based on data from the Civil National Police, last year there were 3,200 victims of sexual violence at home, and 56% of victims were minors. In this context, there are also other factors that increase the violence against women. The economic impact of the pandemic, loss of livelihood, income, or job disproportionately affects women in the informal sector and can create additional barriers to move away from the perpetrator and denounce him due to economic dependency and/or extortion. In times of crisis, sexual exploitation and forced marriages or unions tend to increase due to the lack of resources to cover the basic needs of families. Restrictions on mobility affect the safety of women human rights defenders, who tend to suffer more threats, greater criminalization, and greater risk of femicide. Health workers, who represent 73% of this sector, are exposed to multiple forms of violence in the workplace, on public roads, and even in their homes. Women in situations of greater vulnerability to discrimination may face even higher risks or additional obstacles to access essential services or flee in situations of violence, such as older women, women with disabilities, with diverse sexual orientation, trans, living with HIV, migrants, displaced, and refugees. As online time and the virtual exposure of women and girls in general increases when they have access to internet, the cyber violence and cyberbullying are intensifying in spaces such as social networks, chat rooms, teleconferencing services, and online games. The LGBTIQ+ community reports an increase in tensions in homes where their gender identities are not respected or recognized, as well as increased exposure to gender violence and abuse. In terms of care, this pandemic has tripled the work of women do. The impact of the quarantine in the women's work is high. Apart from the productive work that many women must do, the reproductive and unpaid work increases. The care of minors, persons with disabilities, or older people increases. Then, the impact of economy of care is affecting more to women. As UN Women, we consider at least 4 key types of measures that must be due to minimize the impact of the violence against women in the context of the COVID-19 pandemic. First, ensure that services for care and response to violence against women are considered essential services during the pandemic. We are talking about health, justice, legal, and psychosocial services, as well as shelters and economic subsidies. Second, increase investment in the prevention of violence against women and girls during the crisis and in the recovery phase. Third, public campaigns and effective measures of zero tolerance. And fourth, work closely with grassroots women's and civil society organizations, feminist women's networks, and human rights defenders. In the pandemic context in El Salvador, UN Women has taken several measures to face violence against women. In the framework of the Spotlight Initiative, which United Nations carries out in various regions of the world with the support of the European Union, UN Women and the other implementing agencies have reprogrammed the work plan to adjust it to the new context. In particular, UN Women has supported the strengthening of the helplines of ISDEMU, of the police, and the Supreme Court to improve the capacities of the teams that provides attention in helplines and to increase the number of lines available. We also developed a proposal to include addressing violence against women as an exception to quarantine so that women are not prevented from going out to report and seek support even in the midst of quarantine. This provision was included in the national emergency law and constitutes a very important precedent for the country and for the region, as it recognizes the weight of VAO in the context of emergencies and in particular opens up the possibilities of supporting isolated women. In addition, we have developed media campaigns through social networks to prevent violence and to inform about helplines. We are using too the hashtag No Estás Sola. Also, a campaign to transmit messages of support to women during this period, which have been joined by public officials, community leaders, parliamentary members, mayors, ambassadors, and others. Finally, we supported the design of credit and guarantee funds for micro and small women entrepreneurs. We are continuing providing support to 2 emblematic programs in El Salvador, Ciudad Mujer, which was mentioned by Mary, and Unimujeres ODAC, which are the specialized offices of the police to attend violence against women. We provided them with support in equipment, training, and protocols and others. We are continuing providing support to these 2 programs. We hope that these measures can contribute to mitigate the impact of violence against women in El Salvador in the current context. Thank you very much.
Thank you so much, Ana Elena. And now we will turn to our last speaker, who is Daniela Marquez-Grelin, who is the Executive Director of Avon Institute for Brazil. She leads the Institute's efforts to fight breast cancer and violence against women in Brazil. And in this role, she drives awareness and engagement campaigns to transform attitudes and behaviors, moving these issues from taboo to public discussion, and victims from isolation to empowerment. She articulates partnerships to support and leverage selected scientific research and produces proprietary research to advance progress against two of the major obstacles to women's empowerment. Before joining Avon, Guerlain led Dow Chemical's public affairs function in Brazil. She holds a bachelor's degree in international business, an MBA from Thunderbird School of Global Management, and a postgraduate degree in organizational leadership from the University of Pittsburgh. And she is the mother of a 16-year-old girl and a 9-year-old boy. So Daniela, I think those are your slides. Please go ahead.
Yes. Hi. Thanks for your invitation. It is indeed a pleasure and a great honor to be beside you. I wonder if you can all see my screen at this moment.
I see grid marks. Now I see this.
Okay, I am trying to put this at a slide view.
If you can put it in a
yes.
slideshow view, that would be great.
That's what I'm trying to do, but for some reason, it doesn't go through. Well,
why don't you leave it as it is then? I think that'll be fine.
Okay, I'll try. So please let me start by explaining what Avon Institute does in Brazil. Avon, we are the local chapter of Avon Foundation, which is dedicated to fighting violence against women and girls all over the world. To do so, we work through three main pillars. First of them, we encourage the conversation around gender-based violence. We believe it is very important to name the enemy, to name the problems that we are dealing with in order to articulate our ideas and encourage the discussion so that people understand that violence against women and girls is a society problem. We also work to provide information and encourage action. And we do so by publishing research every year, studying different aspects of gender-based violence, and encouraging action on different sectors in the private sector itself, at the civil society, and also government authorities. Finally, we work to increase the support and improve the level of services across the support network for women in situations of violence. We look at violence against women and girls as a systemic problem. And as such, we look at events, but we also try to understand trends as they develop along the time. We also look even deeper to see how society institutions have a role, how they can act to address the problems. And when we look at institutions, we are also looking at the private sectors. We are looking at companies as social actors and what role they can undertake in order to tackle this problem. And finally, we look at the cultural background or mindsets, as we say, to understand what are the cultural roots of such a systemic problem as violence against women and girls. As part of this work and looking at the different institutions, as I mentioned, we look at the private sector, trying to understand what role we could undertake in addressing violence against women and girls in Brazil as a coordinated sector. We know through research that in Brazil, 1 in every 5 absences to work is motivated by an episode of domestic violence. So although companies do not always understand and do not always see clearly, as a sector, they do incur in costs of around 1 billion reais per year as a direct result of absence caused by violence against women and girls. And looking at that data, we reached out to the corporate section in Brazil and created what has become known as the Corporate Coalition to End Violence Against Women. This movement was initiated last August we reached out to companies that had already signed the Women Empowerment Principles proposed by UN Women. We also looked at Avon's own campaign and invited CEOs to participate in this movement to end violence against girls. This movement or this coalition is meant to articulate companies to end sexual and moral harassment in the workplace. That's one basic thing that all of us try to accomplish, but also to help companies to be able to support victims of gender and domestic violence and other companies in their own value chain to do the same. And therefore, we're trying together to build a society that is helping supporting women so they a life free of gender violence. When the pandemic hit Brazil and we experienced this crisis after other countries in Asia and in Europe, we already knew about the impact that the pandemic and the social isolation could have on gender-based violence. And yet the same effect occurred in Brazil. As mentioned by another speaker before me, the rates of feminicide in Brazil went up by 22% during this period. And some kinds of violence were underreported. We noticed that in the beginning, women didn't know exactly how the support systems were working. So there was an initial drop in reports of cases, but then later on, they managed to understand how the services were working in their states, and then the rates went up again, especially the feminicide rates, which cannot be underreported, let's say. As a result, Avon globally, through the Avon Foundation, has undertaken a campaign which is composed of 3 stages. The first one is a campaign, an advertising campaign meant at building awareness of this shadow pandemic and encouraging every citizen to take a role, to take a stand and help violence victims. Our campaign was called Isolated, Not Alone. It had different hashtags all across the world, but in Brazil, we created the Isolada Sim, Sozinhas Não. We created a number of pieces, films, and posts, social media posts, helping people, helping neighbors, and encouraging people to see gender violence not as a police problem, but as a problem that touches all of us. Therefore, all of us have a role to play in addressing it. The second pillar of this response was a program to support women in situations of violence. This program that we undertook in Brazil, and it's a shame that I cannot navigate through my slides because I had prepared some slides to share with you, but I'll try to explain how it worked. We looked at victims, we put women in the center, and we tried to address their most emergent needs during a situation of this pandemic. We looked at material needs, the psychological, emotional, social needs, and also even their spiritual needs. And we created a network of services to first facilitate their request for help. So we created an artificial intelligence tool that's available through WhatsApp that can be used by all women in Brazil who want to ask for help. In this tool, we make some preliminary questions using the same international protocol called FRIDA that's used in the Ligue 180 services. Through their answers to these questions, we can estimate the level of risk they're undergoing and propose a number of assistances that range from basic material assistances like meals, temporary lodging in hotels, hotel rooms, or shelters, or even psychological or legal assistance that can be obtained by through a network of voluntary professionals that was mapped 1 year ago through a partner organization called Mapa do Acolhimento. By putting all these assistances together and facilitating the request for help, we have managed to help 2,000 victims in the last 2 months. We believe this is a very powerful tool that is increasingly being adopted by different companies that together with us have made the corporate coalition to end violence against women. This initiative in Brazil today encompasses more than 100 companies, and we have also joined forces to amplify the awareness campaigns and to amplify and to exchange best practices and amplify the use of this support tool that we have created. Finally, the third phase of this campaign is an advocacy effort that we are initiating in Brazil, directed to different levels of government, asking them to put services that help victims of domestic violence up front and as the focus of government investment. And the next step of this program is an emergency fund that we are creating and that we are inviting all social investors to invest in. Because what we say in Brazil is that the volume of social investment has increased significantly during the pandemic. However, as it often happens, the percentage of this investment that is directed to women's rights programs is minimum. So we have initiated this emergency fund to invite companies to invest in women, but also to raise awareness on the importance of funding programs that are meant to support women that deal with this double challenge of addressing the pandemic itself, but also living free of violence. I guess that given the time limits that I have, I'll stop here, Mary, Dr. Ellsberg, and then over to you, and I'm available to answer any questions that you might have.
Perfect. Thank you very much, Daniela. I'm really sorry we didn't get to see your slides, particularly because I love the colors. If you look at my background, you can see that we both like the same kinds of colors. I'm going to ask one question maybe, and then we have some questions already from the public. We don't have too much time, but I'd like to start with something big, and not to put you on the spot, but several of you, and this is for all four of you, you've talked about violence against women being a systemic problem, and that largely it's an issue of political will, and that we were not doing too well on that beforehand. But we haven't really discussed the fact that Latin America is right now the hotspot for COVID-19. So not only are we having political problems in terms of addressing violence and addressing gender inequality, but this is happening in the context of many countries who have some of the, right now, the who are really not addressing the pandemic itself very well. And that, of course, is then leading to more violence and more problems. And it's going to be that much harder for us to come back from it. So in this context of Latin America and that broader context of the pandemic, I'm wondering, of all the things that you've mentioned, the innovative practices, once things get a little bit better and open up more, to what degree are we really going to spend the next several years just trying to get back to where we were before the pandemic? And is there anything being optimistic that is being done now that's innovative that we might be able to maintain or use for the future? So it's a big and challenging question, but if any of you have thoughts on that, I'd love to hear it. You're nodding, Ana Elena. Do you have something to say?
Okay, Mary. Yes, well, it's a hard question, no? But I think we need to see this context, the current context, as an opportunity to raise the issues that we need to put in the public agenda for the new normality, no? The called new normality, we need to say, okay, in the new normality, after the pandemic, we need to put women at the center. We need to put violence against women in the center of the national policies and programs, and in the law. We need to identify the law reforms that we need to deal with the violence and to reduce the high rates of violence in our countries. And I think it's not easy, of course, it's not easy, but we need to talk. In our case, we have very good allies in the police, in some specific institutions like police, like Supreme Court, like the Attorney General Office. And I think we need to promote more alliances between them to create platforms to work together, because one of the main problems to deal with violence against women is the lack of coordination between the different responsibles in the chain of justice. The police work by their own side, and the attorney generals for other side. We need to improve the interinstitutional coordination. We need to improve the helplines to be more effective, because more women have complaints, because many times they call to these lines and they don't get the answer that they need, the response that they need. And we need to work too with civil society organizations, because they are providing several services and support to women's, no? And I think we need to strengthen the local response to the gender violence, because in general, we are waiting for the response at the national level, but we need to like territorialize the response of violence, involve more local governments and institutions at local level, to provide more close response to women.
Thank you. Daniela, I see you raised your hand, and there's also a question here for you. Somebody who said, thank you so much for putting this together. I'm curious about what specific actions the government of Brazil has done to improve data collection and reporting, and what secretariat is doing this. Is it SENASP? So can you add that to your answer to my question? Uh-oh, I think you need to unmute.
You hear me now?
Yes, we can.
Okay. First of all, I just like to say I couldn't agree more with Maria Elena. I think that the reasons that we have to hope are pretty much related to the different differences that can be made on a local level. Here in Brazil, as an example, we traditionally looked for the national authorities to come up with a top to the bottom answers. But as we see, the investment in women's causes hasn't been a priority. So we have been looking to city authorities, to state level authorities, to see what we can do together to get, because at the end of the day, women experience violence in the cities, and there's a lot that can be accomplished on local level. In this sense, we are looking with great interest to the UN Women Safe Cities protocols and programs, because we believe there's a lot to be learned from that. the question was about data gathering in Brazil, right? Today in Brazil, we rely a lot on the information provided by Fórum Brasileiro de Segurança Pública, which was the data that was presented before by one of the speakers. I think it was, I don't remember now who provided. Yes, yeah, Fórum Brasileiro de Segurança Pública. In the federal level, the Human Rights Secretary is responsible for gathering data from the Ligue 180, which is the main support service available for women victims of gender violence in Brazil. They open this data, it's available to the public, and it is today the most important source for data on gender-based violence. It hasn't changed much during the pandemic, this level of data gathering, but they have added chatbot service that has been added to the telephone service. And this provides another avenue, let's say, of data gathering as well.
Okay, thank you, Daniela. And I'm gonna, before I go to Veronica, I'll pass over to Paula also, because there was an additional question around the resources that you were talking about and if those are available, and if you have anything to add to what Daniela said.
Thank you. Yes, so I mean, I agree with her and with the speakers before in terms of the answers for prioritizing. I also feel that part of what's happening now is greater visibility for these issues and greater prioritization on addressing and finding solutions. So in terms of, you know, whether we'll kind of move back or you know, what will happen in the future, I feel like it is an opportunity as well, and it's already proving to be so. We see this in Brazil, we see this in other countries, but we see, for example, prioritized action from the ministry. So for example, in terms of data collection, there is an effort to ensure that data collection can be improved. It's a process, of course, but for example, they've signed an agreement to standardize and automate data collection on violence against women from the Casa da Mulher Brasileira, which are kind of these one-stop shop houses for women or services for women. But there are other initiatives as well. There's a proposal in the Senate, for example, for creating a national policy on statistics information on violence against women. So things are not necessarily improved already, but there is greater visibility and greater attention and prioritization. So I think that's the opportunity that you see now in terms of improving how to address, respond, prevent, but also the data issue, which is one of the big challenges in Brazil, right? Because
sorry, sorry, please go ahead.
Go ahead. No, I mean, the challenge in Brazil is that you don't necessarily have a harmonized systematic system or systematic structure for collecting data, for sharing data. And so it is one of the challenges for just more adequate policy making as well and responding.
That is a challenge throughout not just Latin America, but globally as well. Would you say, any of you, that this increased prioritization and recognition of the issue is being accompanied in any of these cases by additional resources? That's a big issue. We can have better policies, but if we're not going to resource them, you know, how do we make them real? Maybe we'll ask Veronica that one. take the spotlight off.
I'll just quickly add on the resources. So I was just asking how we can share the resources. So there are multiple ways. I mean, one is the note itself hasn't come out, but it'll come out soon, and we'll be sharing it across our World Bank channels. So if you follow World Bank or the World Bank in Brazil, especially on Twitter or any of the social media or on our websites, but we'll also be putting up these resources on the event page. And then what we'll do is everyone that RSVP that registered for the event, once the material is up, including some of the presentations from the speakers, we can share this with everyone who registered. So that's in terms of sharing resources.
Thank you.
But also, I would like to add
Go
some
ahead,
points.
please.
Yeah, thank you very much. Probably just 4 points. The first one is related to resources, and the second one is related to cooperation. The third one is related to good practices, and the fourth one is related to illicit actors, that it's very important in the context of the Latin American experiences. First of all, Mexico has promoted in the United Nations the universal and free access to treatment and vaccines for COVID-19. We need that kind of statements at the international level. We need some leaders on these movements. Probably we haven't sailed our movement in a correct way, because according to the evidence, the international evidence, the WHO evidence, UNODC, USAID, and other international cooperation evidence, it refers that tackling violence against women, we are going to prevent many problems at the short, medium, and long term. And selling that idea to the governments, it's very difficult, but at least if we have one leader at the international level saying that this pandemic is also a gender violence against gender violence pandemic, would be fantastic, saying that accessing more resources for this movement could improve the situation of women and the long term for all. The last statement that I put in my presentation is the better for women, the better for all. And this is based on data and based on evidence and evaluations at very different levels. The second one, it is clear that the state will not be able to cope with this huge crisis on its own. The support, solidarity, and commitment of all social actors is needed. Strategy of multilateralism, as previously you said, is crucial, but many Latin American and Caribbean countries face different government challenges and deep political divide at the national level, which is being mirrored also at a regional level, making South cooperation and regional cooperation very challenges. That is why we need the third one, that is formal cooperation is highly bureaucratic. So how we can make flexible this kind of cooperation from the resources, from experiences, and from, I don't know, shadowings or other kind of mechanisms that we could use. And unfortunately, the door is open not only to illicit actors, but also to the highly adaptable and flexible illicit networks. At some point in Mexico and Brazil, for example, in the favelas, domestic violence was mediated by illicit actors. What is going to happen without specific resources and without tackling effectively domestic violence in different contexts? Because, for example, in Central America and the North Triangle, many illicit actors, such as the Maras, is increasing violence against women instead of controlling, like in the context in Brazil or Mexico. So we have many challenges, but I think a strong statement and international leadership, international cooperation in a flexible mode, and of course, the evidence could improve a lot of the situation that we have right now. Sorry.
Well, thank you very much. There is a question but I think that's a great note to end on, and we need to wind down right now. There's a question specifically around the Avon Institute and how they're working. I wonder, Anya, if it's possible to make that, to give that question directly to Daniela, and she could answer it offline.
Sure, we can do that, and we can add that to the website.
That would be great. I think, sadly, we could talk about this for a very long time, and it's time to wrap up. I would just like to say that I personally am feeling more optimistic. I started the conversation feeling a little disheartened and with how things have been going politically, both in Latin America and, I have to say very clearly, in the United States as well, in the way we're addressing both the COVID-19 pandemic and violence against women. And so, however, I think that this kind of conversation between civil society, private sector, researchers, international organizations like UN Women and the World Bank is exactly what we need to continue to do, to have these dialogues, to exchange ideas, and to continue to think about how to work together moving forward. So I thank all of our panelists, and particularly the World Bank and the Wilson Center, for organizing this and for inviting us to be part of this very rich discussion. And with that, I will say goodbye. And hand over to Anya.
Thank you, Dr. Ellsberg, and to all of our panelists today, as well as to the World Bank for their partnership, Paula Tavares. It's been a pleasure. I would also like to thank my partners at the Wilson Center, Beatriz Garcia-Nice and Olivia Soledad. And I think in closing, as Dr. Ellsberg said, it's really important to take away from this not just what the challenges are, and they are considerable, but there are people and there are organizations working together to come up with ideas and test initiatives. And I think this work is really important to highlight and to draw those best practices and those lessons that we can carry going forward. So thank you all for joining us today, and thanks to our amazing panel.